shout out once again to vitamin D for just being a miracle vitamin. High dose of vitamin D may treat incurable diseases according to the experts. Vitamin D supplements are currently recommended at a dose of 600 international units per day by the National Institute of Health. The NIH, whatever, alongside a warning about potential toxicities if people take more. You have to go well outside those boundaries of 600. Like, you have to be down in a bottle every day. But for some, supplementing with what has seen to be very high dose of vitamin D every day may reap health benefits rather than toxicities. In 2019, board-certified internist Dr. Patrick McCullough. Oh, I thought he was one of those band experts that are out there, but okay, cool. And the expertise of 3 patients were taking high doses between 20 and 60,000 IUs per day. Wow. All 3 of whom have since seen significant health improvements. What do you mean, doc? One patient started supplementing with vitamin D3 8 years before the publication, and the report saw his asthma attacks decline from 5 to 6 severe exacerbations per year to only 1 from 2011 to 2019. Well, that's pretty cool. How do you narrow it down specifically to vitamin D3, though? He initially started with 10,000 IUs per day, but at the time of publication, he had stopped most of his asthma medication and was taking 30,000 IUs daily. That sounds like a lot, but if it's under proper medical supervision, I don't see that being a problem. Although patient's ulcerated hand lesion, which was presumed to be a form of skin cancer, shrank after taking high doses. Yo! One patient had excessive psoriasis plaques from his scalp, forehead, and ears, as well as smaller plaques on his chest, abdomen, elbows, and thighs. So just really, really gross-ass psoriasis all over his body. He was given 50,000 IUs of vitamin D2 and he soon saw dramatic improvements in his psoriasis. Skin cleared a few months of treatment and was able to stop using steroid creams and medicated shampoos. Yo, this is amazing! So the current NIH recommendations stem from 2010 dietary reference by the IOM Institute of Medicine. Reference suggests a daily intake of 600 IUs that reach a serum level of 20 nanograms per milliliter vitamin D in the blood, an adequate amount, apparently. McCullough argued that the current dose recommended by the IOM are sub-physiological. Instead, McCullough proposed 10,000 IUs a day would be adequate physiological dose. Interesting. Prior to the IOM's recommendations, experts on the Council for Responsible Nutrition suggested increasing the maximum daily limit be set at 10,000 IUs. Oh, okay, so even they were on this as well. In 2011, the Endocrine Society similarly said that up to 10,000 IUs per day was safe for adults. Multiple papers in the literature show that vitamin D has a host of roles across multiple processes and organs. The cells have a specific receptor for vitamin D, and when the vitamin D molecule binds to its receptor, it can activate around 2,000 genes in the body. Vitamin D expert William Grant has published over 300 papers on vitamin D. Cool. So I would consider him to be an expert. Just saying. Vitamin D, however, acts as the genetic pathway and is a direct contributor rather than an assistant, regulating calcium levels and parathyroid hormones. Most importantly, while the other vitamins have to be obtained through the diet, body can naturally get vitamin D through sunlight. We know that as well. So 600. So your NIH recommended dose is definitely not enough. So for this reason, some experts suggest that vitamin D is needed in a much higher dose than what is being recommended to maintain general health. Board-certified internist and integrative medicine physicians, all jumbled up. Dr. Anna Michela, said that most of her patients need 10,000 IUs a day to reach optimal function with their cognition and energy levels. She once boosted the serum up to 20 nanograms per milliliter in one patient using supplements and saw some great improvements. Michela indicated vitamin D deficiencies may have been a culprit for their symptoms, which included fatigue, muscle weakness, and poor cognitive ability. variabilities. Interesting. A surgeon and physician of more than 20 years, Dr. Joseph Bolasevic, well, not that, it's more Slovakian, more than likely. Likewise, reports great variability in optimal vitamin D serum levels among different patients. His patients saw great improvement once their levels hit 60 nanograms. Other patients might need 120. Studies have shown the vitamin D toxicity may develop when the serum levels hit 150, but McCullough and some other patients operate fine at more than 200 nanograms per milliliter. I would say further studies are required because that's all great and wonderful and stuff. It's just knowing that vitamins A, D, E, and K and their various substrands are all fat-soluble vitamins, so there is a propensity for there to run a toxicity. It's just how much fat are you dealing with? So I guess, yeah, that would be kind of a case-by-case basis, if you will. Doctors say people with certain pathologies may need more vitamin D than healthy people, especially those with autoimmune disease. Vitamin D, which would also be the psoriasis issue, that's where that guy got, well, at least significant relief by upping his vitamin D dose, and activates immune cells that counteract autoimmune responses. Talking about vitamin D regulation. Some autoimmune disease patients have vitamin D resistance. Okay, therefore they need higher doses of D, ladies, to raise their serum levels. Autoimmune specialist Dr. Cicero Combria, who authored the famous Combra protocol, may have found his patients with multiple sclerosis reach remission after taking massive doses of vitamin D. Start as low as 150 IUs per day. The protocol, this is per kilogram of body weight. Okay, and as high as 1,000, depending on which. I'd imagine you'd probably start to work your way up from there. Combria said his clinic has treated over 15,000 patients with autoimmune diseases, around 85% reach remission. Interesting. Okay, so with cancer, really, higher doses of vitamin D are associated with lower risk of cancer progression and mortality. I think we touched on this recently within the past couple of weeks as well. Since vitamin D acts as a blocking pathway to promote further cancer growth and metastasis, is better at preventing cancer mortalities than cancer incidence, Grant said. All right then. Furthermore, it is uncertain if vitamin D will be effective for all cancers, and the reason for cancer patient ailments vary from one to another. Nonetheless, there has been case reports that cancer remission after taking high dose of vitamin D though the factors may play into other patients' recovery. Anesthesiologist Dr. Judson Somerville said his patient's wife was told by a highly renowned cancer center, MD Anderson Cancer Center in Houston, Texas, that she had only 6 months to live due to an advanced ovarian cancer. She figured she had nothing to lose and started taking high doses of vitamin D3 together with magnesium. Shout out magnesium. The patient's wife started to feel better, and they examined her, and to her surprise, she found she was cancer-free. Yo, that's amazing. So low levels of vitamin D have been associated with higher risk of anxiety, depression, Alzheimer's disease, Parkinson's disease, and the TISM. Dr. Michella, once again, says the brain fog in her patients experience as part of their deficiency would alleviate once they raise their vitamin D levels. My experience, having reached about 100 children with the TISM, is that 25% respond dramatically with high dose of vitamin D. 50% respond significantly. 25% do not respond at all. So what do you necessarily have to lose? Board-certified internist, Dr. Saeed Haider, recommends a certain amount of sun exposure is the best option to get vitamin D. Yeah, otherwise then your body just has to start processing a bunch of different supplements, and it's not optimal, but if you can't get into the sun, because as of right now, the snow just won't stop in northern Alberta, but we're eventually going to get summer, and you're going to have a whole lot of sun, because the sun comes up on and around 6 o'clock in the morning, and it doesn't disappear until about 11 o'clock at night. So if you're not getting enough, then you're just not going outside, you dork. A person can supplement with either plant-based vitamin D2 to To be completely honest, I'm not all that familiar with D2, okay? Known as ergocalciferol. All right, vitamin D, or animal-based vitamin D3, known as the good stuff. All right, between the two, the doctors tend to prescribe vitamin D2 because it is more available on the market. Okay, D3 less associated with toxicity, and the body is more tolerant of it. Yeah, that's what I would go with. Okay, yeah, and the way that I get vitamin D3 is with vitamin K as well. Oh, D3 and K2. That's what that is. Yeah, no, there it is. It is advisable to take vitamins D and K2 and magnesium when supplementing. That's just naturally the concoction that I end up making. And it will prevent vitamin D toxicity. Hey, shout out. All right, then. The more you know. Vitamin K2 and magnesium help calcium or deposit calcium into the bones rather than the arteries, and therefore prevents hypercalcemia, which can occur as a result of vitamin D toxicity. Okay, there you go. If you're wondering, it's like, okay, I don't want to run a toxicity with vitamin D. Well, unless you're downing a bottle and you're ingesting like 70,000 IUs a day, which is in on and around. I got a supplement. I got a spare in here. It's actually right up at the front. So I got the little Jameson gimmicks right here. So this one has 375 tablets. Each serving is 1,000 IUs. So yeah, unless you're doing, like you could get 3 days out of this bitch and still be totally fine. Michelle emphasized the importance of testing serum vitamin D levels as an indication of dosage, since the following conditions may impair the absorption of vitamin D: inflammation, stress, obesity, poor gut health. Yeah, and the inflammation you can start working on if you're going outside and exercising. That'll help as well. And then also if you want to get vitamin K2, or vitamin D2, sorry. If you want to get that through natural ways, you would normally be eating a better diet anyway, so that would definitely help with your inflammation and your obesity. Your gut health would also be helped as well, and stress overall. Well, if you're stressing about being a fat ass, that could all help as well. Endocrinologist and vitamin D expert Dr. Michael Holick has shown obese people tend to be deficient, since the extra fat in their body sequesters more vitamin D in their cells rather than allowing it to free float in serum. Interesting. So thinner people require less vitamin D because it's not being stored as much. Good to know. At least that's the correlation that I'm making right here, which is why obese people tend to need several times more than the recommended dosage. So the people that you're seeing at 50,000 IUs, chances are they've got some other problems there as well. So vitamin D looks like it's like there's some superfoods that are out there, but it's coming in as the real super vitamin. So make sure you get your share either out in the sun or the good old way. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.